Hello everyone, I'm Dr. Vishnu Gade, Consultant Psychiatrist at Kamineni Hospital, Koti, Hyderabad. And I'm here today to talk to you about mental health and its importance in today's world. In this video, I'll be discussing about what depression is, the causes, the clinical features of depression, what the general public needs to be aware of, and how we can help the people affected by it. So what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps in making choices and handling stress. Mental health is important at every stage of life, from childhood to adolescent to adulthood. Depression is basically a mood disorder, and mood can be defined as a sustained emotion or feeling tone that influences a person's behavior and colors his or her perception of the world. The disorders of mood sometimes are also called as affective disorders, and they can make up an important category of psychiatric illnesses consisting of, for example, depressive disorder, bipolar disorder, etc. So, depression is a state of low mood and a strong dislike towards activity. It can either be short-term or long-term. Other terms used to describe depression are feeling low, sad, distressed, empty, melancholic. Some can be observed by the doctor, example, an unhappy facial expression or body language, and others can be felt only by the patient, for example, loneliness and hopelessness. 97% of the depressed patients complain about reduced energy, difficulty finishing tasks, and are impaired at school and work. About 80% of the patients complain about trouble sleeping, especially early morning awakening, multiple awakening at night, during which they overthink about their problems. Anxiety is also a common symptom of depression, and it affects about 90% of all depressed patients. Anxiety, including panic attacks, alcohol abuse, and somatic complaints such as constipation and headaches, often complicate the treatment of depression. Now I'll be talking about the prevalence and possible causes of depression. So, major depressive disorder has the highest lifetime prevalence of any psychiatric disorder and is the leading cause of disability worldwide. For the probable causes of depression, there is a genetic component about 35%, and families also have high rates of anxiety disorders and neuroticism, suggesting a shared genetic basis. Coming to sex, there is a greater prevalence of major depressive disorder in women than in men. The reasons for the difference could be hormonal differences, the effects of childbirth, different psychosocial stresses for women and for men. Major depressive disorder can also begin in childhood or in old age. In childhood experiences, for example, loss of a parent, lack of parental care, and parental alcoholism and antisocial traits, childhood sexual abuse, all of these could lead to depression. High intelligence and one good adult relationship are protective factors and increase the resilience in the patient. Psychosocial circumstances such as marital status, in which high rates of depression are associated with separation or divorce, and any adverse life events, particularly loss of loved ones. These vulnerable individuals are at an increased risk 2 to 3 months after the event, and also any associated physical illness, especially if chronic, severe, or painful. They could either be neurological disorders such as Parkinson's disease, multiple sclerosis, stroke, epilepsy, or post-myocardial infarction, diabetes, and cancer. It has been found that treatment of a coexisting depressive disorder can improve the course and prognosis of the underlying medical disorder as well. The three neurotransmitters implicated in depression are dopamine, serotonin, and norepinephrine. Low levels of these neurotransmitters can contribute to depression. Also, depletion of serotonin may precipitate depression. There are few psychiatric disorders like alcohol dependence, panic disorder, OCD, which is obsessive compulsive disorder, and anxiety disorder, which may lead to depression. Coming to personality traits, no single personality trait or type uniquely predisposes a person to depression. All humans of whatever personality pattern can and do become depressed under appropriate circumstances. But persons with OCD, histrionic, and borderline types may be at a greater risk for depression. Certain common drugs, including beta blockers used for hypertension, isotretinoin used for acne, oral contraceptives, anticonvulsants, have been reported to cause depression as well. Several drugs of abuse can cause or exacerbate depression. These include alcohol, sedatives such as benzodiazepines, opioids, and prescription painkillers, and illicit drug use such as heroin and cocaine. So now coming to the signs and symptoms commonly presented by the depressed patient. For many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities such as work, school, social activities, or relationship with others. In these people, sad mood is the key symptom, and 50% of the patients deny having these depressive feelings and do not appear to be particularly depressed. So usually the family members or friends bring or send these patients for treatment because of the social withdrawal and generally decreased activity, and some of these patients may feel generally miserable or unhappy without even knowing why. The depression signs and symptoms vary from person to person. They may be feelings of sadness, crying spells, emptiness and loneliness, reduced self-esteem and self-confidence, bleak and pessimistic views of the future, angry outbursts, irritability or frustration, even for very small issues, loss of interest or pleasure in most of the normal activities, for example, hobbies, sports, sex, sleeping too less or sleeping too much, tiredness and lack of energy, doing even small tasks take extra effort, changes in the appetite. There may be reduced appetite with weight loss or increased craving for food with weight gain, anxiety or restlessness. The thinking process becomes slow. The speaking also becomes slow. The body movements also become slow. Feelings of worthlessness or guilt, fixating on past failures or blaming yourself for things that aren't the patient's responsibility. The patient also has trouble thinking, concentrating, making decisions, and remembering things. Frequent or recurrent mention of death, suicidal thoughts, suicide attempts, or even suicide. Unexplained somatic physical problems such as back pain or headaches, etc. Children and teens may show depression by being irritable or cranky rather than sad. Now let's talk about these features a little bit in depth. So coming to speech. Many depressed patients have decreased rate and volume of speech, and they respond to questions with single words and are also slow to respond to the questions. The other features include perceptual disturbances like delusions or hallucinations. These patients have a negative view about the world and also of themselves. And in memory, 50 to 75% of the patients have a cognitive impairment, sometimes referred to as depressive pseudo-dementia, and they commonly complain of impaired concentration and forgetfulness. More than 50% of all depressed patients have suicidal ideation at some point, while about 10 to 15% of these patients become more impulsive and commit suicide. Depression is also seen in children and adolescents in this generation. They may present with symptoms like school phobia, excessive clinging to the parents, poor academic performance, substance abuse, and antisocial behavior. And coming to the older people, depression is more common in elderly people than it is in the normal general population. Various studies have reported prevalence rates ranging from 25 to almost 50%. The various changes in food intake and appetite and rest can aggravate the coexisting medical illnesses such as diabetes, hypertension, chronic obstructive lung disease, and heart disease. Other vegetative symptoms include abnormal menstrual cycle and decreased interest and performance in sexual activities also. The consequences of depression further lead to significant burden to public health, which include higher risk of dementia, premature mortality arising from physical disorders, and maternal depression, which impacts on the child growth and the child development. So, if you see these above mentioned signs or symptoms in your family members or loved ones or friends, please do refer them to a mental health professional like a psychiatrist so that the treatment may be initiated at the earliest. I hope this video was informative and wish everyone good health and stay safe. Thank you.